Your story, Jen.
Hi, I'm Jenn Coffey from Manchester, New Hampshire. I'm a member of People's Action Care Over Cost campaign. For about 20 years of my life, I worked in healthcare. For the better part of the last decade as an EMT. I owned a home. I worked my ass off to buy it, and mostly by holding down more than one job. At 42, a routine mammogram revealed breast cancer. Within less than a month, I would work my last shift in the ER and never respond to another 911 call again. Within 11 months, my entire life as knew it was ended, and I lost everything. I became bedbound for 2 years. I developed CRPS, complex regional pain syndrome, and small fiber neuropathy. CRPS is also known as the suicide disease. It's the most painful disease known to medicine, and yet it has not one single approved treatment by the FDA. United Healthcare loves to use that fact as an excuse to deny care. I have no idea how I ended up on a Medicare disadvantage plan. My health got bad, and my stays in the hospital so frequent, I had no quality of life left. The pain became so bad, I talked to my doctor about signing a DNR, a do not resuscitate order. I did a GoFundMe. I sold everything, including my car, and I bought my way into treatments. United Healthcare, Medicare, disadvantage refuses to cover those treatments. I raised enough money to pay for them, and over 5 years now, I've been the only one fighting to keep myself alive. I went to a meeting and I found out that there were people who were willing to help me fight. It wasn't an easy decision to make, going public, sharing some of the worst moments of my life. It took a public social media campaign and 4,000 signatures on a petition to get United Healthcare to talk to me. They didn't like the embarrassment, considering that my videos launched the same day that they were bragging about an $8 billion profit for just the first quarter. That's only 3 months of this year. They deny care while pocketing our premiums. You know, United Healthcare said that they would pay for my infusion after all of that, but when the cameras went away, so did the approval department. It was friggin' bullshit. They lied to me, and we're still fighting. You know, recently I asked Senator Hassan to help me, and within 2 days of her office reaching out, United Healthcare was back on the phone with me. I had 2 of their employees insist that my infusion was about to be covered, but they were never willing to put it in writing. In the end, they gave my doctor instructions on how to submit the bills in a whole new way. There was a new website, a new toll-free number, and a department that none of us have ever heard of. They sent a nice circular letter of speech that ended with nothing being approved. At this moment, we're still waiting to see if they pay or if I do as usual. I cannot give up. My life depends on it. I'm fighting back because I'm tired. I'm tired of talking to United Healthcare employees who get to override the care and medications my doctors order while having not one shred of medical knowledge to make that decision. Recently, I had a denial happen within seconds of submitting the form. I received a text message telling me I was denied. Immediately after, the service navigator said to me, "Oh, I thought that was going to happen. It's the name of the medication." So a computer decided. A keyword gave me an instant denial and instructions on writing an appeal. My Medicare disadvantage plan is going to kill me. I want medical freedom, where my care decisions are made by my providers and me, not representatives reading out of a manual or a computer algorithm. We truly need Medicare for all. It's the only way to end healthcare inequality. It's the only way to ensure the working class get the same care as the rich and pampered elite. And with that, I thank you.